All right. Well, good afternoon, everyone. My name is Hannah Brosnan. I am the Executive Director of Mental Health America of Kentucky, and I'm joined today by Kentucky Psychological Foundation, FEAT, which is Families for Effective Autism Treatment, Dr. Cody Davis with Norton Children's Autism Training Center, and Dr. Rachel Buehner with KPF and FEAT. And we are excited to have this webinar today as part of the KPF webinar series and focus on this mission of bringing experts together to provide education, awareness, resources to families on the autism journey. So we will share in the chat links for FEAT, Mental Health America of Kentucky, and KPF. And we'd also love to hear more from you about what mental health topics you want to know about. And we are listening. So if you have ideas for topics, you can share those in the chat. And we'll also share our contact information later on in the chat so that you can reach out to us if you'd like. Thank you so much for joining us today. We're excited to bring together these leaders to provide information that hopefully will be quickly beneficial to you and to your family. We're going to do a deep dive on some pretty intense subject matter. What you hear today is meant to help you to understand and work with some of the concerns around this topic. This is not meant to be medical advice, so please be sure to stick around until the end to hear about resources that you may wish to consider if your child's issues need further clinical attention. There are specialists who can help, and we are grateful to have two of them here today with us. I also just want to note that this topic can feel sensitive or even a bit uncomfortable, but it's one of the most vital transitions in a child's life. Our hope is to have a frank, respectful, and practical conversation that feels like a kitchen table talk between parents and not a lecture. I'm pleased to introduce our two panelists, Dr. Rachel Buehner, former Kentucky Psychological Association president and KPF's incoming 2026 president. She is a member of the board of directors of FEAT, again, that's Families for Effective Autism Treatment of Louisville and Louisville's Home of the Innocents. Dr. Buehner is also the parent of a child on the autism spectrum. Joining also is Dr. Cody Davis, a licensed psychologist with expertise in autism and developmental trajectories. Dr. Davis is with Norton Children's Autism Center and the University of Louisville School of Medicine's Department of Developmental and Behavioral Pediatrics. Welcome, Dr. Buehner and Dr. Davis.
Thank you.
Thank you.
So we will go ahead and jump into our conversation. If anyone has any technical difficulties or needs assistance, please feel free to drop your need in the chat and we'll be happy to help. Dr. Buehner, for many parents, puberty may feel like a looming unknown. From your perspective, why is puberty a particularly important phase to address early with children on the autism spectrum? And what risks do parents sometimes underestimate?
Well, I think it's something that makes everybody a little bit nervous, whether your child is autistic or not. You want to do it right. You want to know if you're having the right conversations and when to have those conversations and whether to revisit those conversations. You don't want to create question marks where there don't need to be any or make your children afraid. On the other hand, there's the value of open communication, of kind of getting in front of things that might make kids upset or nervous. They're going to go through a lot of changes, and just like a lot of things with childhood and development, some of those will be very mysterious and even a little bit scary at times, and much more so for a lot of kids who are on the spectrum who already might have a hard time reading relationships or reading their own feelings. So it can be a time of a lot of changes. So puberty is one of those things where when you're an autism parent, you learn very early on that you've got to do your homework and really be in front of challenges before they arise. You learn how to pack a bag before you leave the house. You just learn to try to be prepared for things before they turn into crises. And this is one of those moments that can be a real opportunity to try to get it right. So I think while it comes with a lot of challenges, we're made for this. We know what to do. We were having some technical difficulties.
Yes.
Hannah, we're having a hard oh, there you are. Hey, okay, great.
Thank you so much. So sorry, everyone. We've unfortunately had some unwelcome content in some of our past webinars, so we have some restrictions on muting, and I totally forgot and accidentally muted myself. So thank you for your patience, and thank you so much, Dr. Buehner, for that informative answer. I'd love to hear from you, Dr. Davis. How have you observed the impacts of this big life change in terms of stress, confusion, or behavior change in your clients with autism?
So I think it does start, it's kind of, it's something we're prepared for, but also comes quickly. And so I think the stress of that and how that changes our children and with or without autism, but also the children around them and how that affects kind of the core part of autism is these social interactions. So not only how the child himself or herself behave, but also the children around them and the complexities related to that, and new anxieties, sometimes new routines, new rigidities that can come along. So, also true across all, children going through puberty and going into adolescence, the changes in a mood, stress levels, changes in behaviors that maybe seem to fade and seem to turn their head back, and being able to understand these social roles that start to develop. And along with puberty comes, for many of our children, just greater self-awareness as well, which is a new challenge. And so you've got not only the changes, for example, just in your body and the changes there, but the changes and complexities that go around that. So and this can intensify in puberty and especially in autism because of some differences in for example, the HPA axis and cortisol levels can be a little different in kids with autism. And so we're aware of this kind of oncoming events. We don't know how it's going to be exactly for our children. And I think that's where a lot of the stress comes, is like and for a lot of our kids, I think we can identify a lot of the predictability that children with autism want. That's what's causing the stress for them, but also causing the stress for parents, because we don't know how exactly it's going to affect that individual kid.
Thank you so much for sharing. And it sounds like, here you're speaking to the point Dr. Buehner made earlier about having that conversation early on.
Absolutely.
And I really appreciate, Dr. Davis, what you're saying, the complexities of other children. Like, there are so many variables to try to take into account, but I think kind of at a big scale, being here today, for example, parents and families who are listening today or might listen down the road when it's stored in the KPF library, like the idea of saying, just like I know that I have to be prepared and kind of think through what some of the challenges may be today or with this program or with this school year, I'll prepare my child as best as I can. I'll try to kind of run the point and understand what the challenges will be, but I'll also try to teach them strategies to understand what's happening, be ready for transitions, regulate themselves. So like I say, I think that there's real power for us as a strategy for parents in understanding that I know that I'm going to do my best to prepare myself, understand the situation, understand the challenges, and prepare them and empower and support them. So I think that we fight these kind of battles on a pretty regular basis when you've got a child who's on the spectrum, and try to smooth the road for them to some extent. So I think just kind of pushing that forward and doing what we know how to do can be one lens on all of this that can be really empowering.
Absolutely. Dr. Buehner, in light of that, what's one key mindset or attitude that you encourage parents to adopt before puberty begins?
I think understanding that, like Dr. Davis said, there are going to be a lot of changes that are going to be happening, and understanding and acknowledging our own fears about that sort of thing. And then, like I say, we don't stay stuck in fear for too long as parents. Like, you realize you have to kind of understand the challenges that are out there, what they're bringing to you, what they're verbalizing, what they're perhaps not telling you or communicating to you. And then having an attitude of, we'll work through this together. I'll do my best to help support you. You know what I mean? So there are going to be question marks. There are going to be things that we don't understand, but I'll always be a soft place to land.
Wonderful. Thank you. Dr. Davis, one of the areas that can cause confusion is private versus public behavior and what is acceptable in private versus public. How do you recommend parents begin talking with their child about private behaviors and what language or approaches tend to be effective?
Well, I think that's such a great question, because I think that's one of the bigger stressors, that all parents have. And I think to Dr. Buehner's point, though, parents of kids with autism are uniquely prepared for this in a way. And all of these changes are happening and have been prepared. They've been practicing this for years and years. And what's interesting is research has shown that the confidence level in discussing private and public or sexuality is pretty low among parents. And I think that's one of the scary things. But I think the confidence boosting thing is that you've been through these kind of things before. You're adjusting and doing a lot of the same. It's just new topics, and in a topic that's maybe somewhat taboo, depending on the family, right? But it's a lot of the same approaches. And so, I think I always say, and this is absolutely true within this topic too, is that, the work that we do and the research that's done and all of that, like, it's put into practice by the parents. And that's what truly happens. We might read a lot about this, but the parents are the ones that are really putting these things into, and they know the individual that they're working with, right? They're the expert on their child. And so a lot of the things come back to what worked for you, but what has worked for you in the past? Has it been like a use of visuals or use of role plays or use of more like behavioral techniques that I think might be needed? Is it been more of a discussion and just showing really clear language, concise, clear language of what the topic is? And I think especially within this topic, just because it's more, depending on, again, the family, this is often an area that I think providers give the resources for, but the families really truly have to implement, because there's different beliefs about sexuality and different beliefs about how we treat our bodies and things like that. So I think it becomes, well, how do we do it effectively? For example, public and private behaviors, right? And it's that clear, concise language. It's the use of realistic terms. Again, the stress that comes with this sometimes is that it could be seen as a taboo or uncomfortable topic. I don't want to talk to my son about this or my daughter about this because it feels uncomfortable. But the reality is the more we normalize that conversation and those words and those realistic terms, more likely we're going to be able to prepare our children for these changes that are coming up. And a lot of times for things like public versus private behaviors, it's starting earlier ideally than puberty's onset, right? Is trying to get into some of these routines and practices before they're truly needed. But even if it's gotten to the point that, hey, we need this now and we pushed it off, it's still that clear, concise, realistic, even the use of realistic pictures can be helpful. And there's a lot of websites that and really good. So the Organization for Autism Research provides a lot of good resources. Vanderbilt provides very good use of visuals that are realistic but appropriate for teaching, right? So combined with the resources that are out there and the parents' experience with this, a public and private situation could be as simple as setting up a behavioral principle of, these are the 2 rooms that this behavior is allowed in, or very clearly stating things like, I know some families that have sent like swimsuit areas or private areas to give more of a realistic model of what private parts of your body look like. And so again, clear, concise, simple scripts that are normalized can be very helpful.
Thank you. And thank you so much for sharing those resources. We have a parent who shared in the chat that something that helped with them and their child was just establishing a code to identify what could not be spoken about in public. And I see here we also have a request for links to some of those resources. So Cassandra, we will get those to you either in the chat or via follow-up email. Dr. Buehner, from your experience as a clinician and as a parent, what are some stumbling blocks that parents often face when starting these conversations, and how can they overcome these?
Well, Dr. Davis mentioned something really interesting a moment ago. He talked about how parents might find some of these topics to be somewhat taboo or certainly uncomfortable to bring up for the first time or to start kind of generating conversations out of nowhere. But one thing that I found, of course, with my own child and also sort of anecdotally working with families for a few years now is taboo is often an element of things that we attach, non-autistic individuals might attach to a topic. So if I want to bring up the bodily changes that happen during puberty, you know, I might read a book with my son. We read What Happened to Tom, which is just a picture book about kind of some of the changes to expect during puberty for boys. And he was more astonished at the idea that they put pictures of bodies in a book than he was about the changes that might potentially happen. But it gave us a starting point for the conversation so that we can revisit the conversation. So really, if we think for a moment about what I'd like for my child to have is information about some of the things to expect. And I don't want to walk into it too giggly or ashamed to be bringing it up. Certainly it's uncomfortable, and we can acknowledge that we're here today to kind of work through some of the awkwardness around it so that we know what to do. So the idea here is I want my child to have information. I want for them to know what to expect. I want to get in front of some of the things that might be misconceptions or misinterpretations about things so that they feel less scared. So once again, we go back to the principle of I just want to equip my child as best as I can. So to say I'm going to have a conversation, and perhaps I'll use a book so I have some sort of way to start this dialogue. And then to remind yourself, I'm going to work through my embarrassment. I'm not going to give them any ideas about things to go out and do. There's a very distinct possibility they may have heard about some of this stuff or will hear about it from peers, or someone might be joking or using different words. And if I can make a decision to try to approach those conversations in a way as with an effort to be informative and to just get the information to them, I want to equip my child the best way that I can, then I think it can be really useful because it gets us out of that thinking of I'm supposed to attach embarrassment and shame to this, and into that I want to equip them with information. And Dr. Davis mentioned, you know, maybe we talk about private behaviors happen in the bathroom or in your bedroom. You know, I've had to tell my child we don't answer the door for Amazon in our underwear. So we were able to take that conversation into a different conversation about what stays covered and why we need to stay covered. And so I think kind of using opportunities in your individual mundane lives to talk about privacy and private behaviors. You've got plenty of subject matter. It's just taking it and kind of using what we've got.
Thank you so much for sharing. To go off of that, Dr. Davis, I know you'd mentioned clear, concise language. Do you have any specific verbiage or conversation prompts that you might suggest to parents? And recognizing that all kids are different and that parents are the experts on their children, is there any way you'd recommend folks consider having this conversation?
Sure. So I think Dr. Buehner, recommendation of using a book can be really helpful to get through some of that. And there's other options out there, and I think it often depends on the developmental level of your child. So regardless of maybe the intellectual level or severity of autism, puberty keeps coming, right? So it's often not affected, right? Because our bodies, the hormones come, right? And that's when the body changes and those starts, and all of that starts to change. And so developmentally though, being able to put that verbiage, those conversation starters within the right developmental level, again, it leans on the expertise of the family. So, for many young children, things like the Tom books, are used maybe in an early childhood, but maybe your child in puberty needs that look at it. There's another, just to give prompts to families, there's another curriculum called Good Touch, Bad Touch that talks about some of these things that, again, gives the verbiage that you need, scripts for you to be able to use during that time. And then on kind of the other end where maybe intellectual skills are less impacted, it's things like the Autism Self-Advocacy Network has good, and our Organization for Autism Research again has nice handouts, nice places to start. Now, that being said, like here's some specific scripts you can use in those settings. I think tone makes a big difference. So not being giggly, not being shy about it, but just being like, this is a neutral response to it. I also think visiting these topics, these conversations frequently and briefly kind of normalize it, right? So if it's not, I'm going to sit down and this is what we're gonna have the talk. That puts a lot of pressure on you, but makes the situation maybe odd. But if these are more frequent, neutral conversations with brief, kind of simple scripts and rules that you can keep in your back pocket, that the child can hold on to. Big thing I think is less so the specific words, honestly, and that the conversation keeps going. And this isn't, and for many children, puberty starts earlier, and for especially females with autism. Some estimates are 9 months earlier than typical. So you might be having these conversations at 8 or 9 or 10, right? And so the big thing is that it's not stopped in one spot, that this is a continuing conversation.
Great, thank you so much. And Dr. Buehner, you and Dr. Davis have both mentioned the Tom books. The changes in bodies during puberty, pubic hair, menstruation, erections, voice changes are salient. So how else would you suggest that parents prepare children on the spectrum for these changes before they happen? And how do you tailor explanations differently for boys and girls?
So Dr. Davis is right. We want to think about how without necessarily a script in our hands, we want to think about how we normally kind of go about our conversations with our kids. So we want to think about ways that we talk about, why I wear deodorant and why we take a bath or a shower every day, and how nice it is when somebody smells good, you know what I mean? And how we don't want to be stinky because we know what that feels like, you know what I mean? And we don't want that. So we want to kind of start encouraging early on things like hygiene. We've been doing this all along, trying to beg our kids to brush their teeth and take a bath or take a shower, as it were. So it's more of the same. And now with this added sort of impetus of, puberty is going to kind of change your body. So here's why we do certain things. And so for girls, I think the discussion of sort of what's going to happen, there are, when you know that time may be approaching based on sort of when mom started her period and other factors, you want to make sure she has a change of clothes in her backpack and has, the supplies just in case she were to start her period. And that can be a conversation starter. So here's where we're putting this in your backpack, and here's what you're going to need to know on that first day. And here's sort of what goes on with your bodies. Even feminine supplies come with instructions and things like that. It can be something to talk about. With girls, oftentimes you're going to meet with a lot of repulsion. They're going to be pretty upset when they find out how that all works. So the idea here is to say, here's how we're going to handle that. So we're going to always make sure you have a change of clothes, and you're going to use these products, and you can use them on clean underwear, and show them how to do that, just so that they're aware of kind of how the process works, so that it's not this, like you said a moment ago, big looming mystery about what's going to happen. Here's how we're going to handle it when the time comes. I've had some families have success with both girls and boys with kind of incentivizing good hygiene. So if you take 5 great showers this week, let's go shopping this weekend let's go get you a treat, or go have some special time, or go to the card shop, or, something that kind of fits with their interests. So a reinforcement schedule. So notice I didn't say like a discipline schedule for here's what happens if you don't, but kind of framing it up in a positive way has been useful for a lot of families with whom I work. And again, I think using books early on in those conversations, and they notice you're having this conversation with them and you're not you're not acting ashamed. You're not, apologetic or, bashful about these kinds of things. It's something that we can talk about. And then we can talk about how this is a conversation for me and you to have. So we don't have to go to school and talk about this to a million different people. Kids sometimes once you arm them with new information, sometimes they can't wait to go tell everybody. And that's not necessarily something we want to hinder altogether, but we do want to talk about how this is something for me and you that we're going to keep talking about. I'm glad we were able to talk about it today.
Thank you. Yeah, it sounds like these are some really great strategies, both to talk with the child and then also, as you've mentioned, equip them with the skills and the tools that they need to navigate these changes. Dr. Davis, in your clinical work, have you come across any additional strategies for teaching those body change topics that parents might adopt?
Yeah, so I think it's interesting in the research from on this topic, especially within the context of autism, is that there's interventions that are effective for increasing knowledge, and then there's interventions that are effective for changing behaviors. And Dr. Buehner touched on both of those, right? So like there's been like, hey, and oftentimes when it comes down to it, it's not one program. And so that's why, you'll get a list of 10 because you have to individualize it for your child. And so the one part of that is increasing the knowledge of it. The other part is truly like seeing the behavior change that might be needed, right? So when I think about that, it is again, I think an important topic to say again is just to start early. So oftentimes that might be even establishing routines early. So before the child is stinky, right? You're already maybe a year before starting the routine to wear deodorant, for example. So that when the child truly needs it, maybe you've gotten through some of those hard transitions, right? And they've gotten into the routine already. And that could be used across other topics too, or other tasks as well. I think that, also often the case, our children with autism and comorbid ADHD, sometimes that can be especially helpful, where the routine starting early, same time of day, same, part of that morning routine that's established, and then you as the parent or you're the accountability partner in a way to keep them accountable to that is really helpful. And then absolutely they're not going to get the praise for that directly like we would hope. We don't want people later to say you smell good, or we don't expect that to happen, or even those that literally say you smell, right? So it's got to be some of those systems that are in place with you to help reinforce those behaviors, because they might not, child might not connect this with this consequence. My not doing this is leading to this social difficulty at school. And so linking that as closely as you can with the child, I think, is an important step to be able to help them establish some of these routines that go along with these big body changes. And again, it starts with the social narrative. It starts with practicing of the right way to do it and the wrong way to do it, and showing role plays of that even, and being able to practice that skill and get it almost like motor memory. Some of these things can be really helpful, and then to generalize it as much as possible, across people and settings. So yeah, those are the things that I think of most.
I mentioned one too, Dr. Davis, I'm sorry to interrupt you, but I've had some families too report success telling or helping a child understand how to take a shower, like how to get themselves clean. Sometimes we just assume like, get in there, please don't flood the bathroom and we're good. You know what I mean? Or pretend like you use soap, something like that. But now we know that it's going to be even more critical that they know how to take a shower. So it might be worth just a dry run of here's all the parts you want to make sure that you hit. And if they have an easier time with using body wash and a rag than they do with using bar soap, again, something to consider at a sensory level. What can I do to ease this as much as possible? And for those of you, sometimes we go through one of these webinars. I know when I go to one myself as a parent, sometimes I'll learn something and I'll realize like I kind of missed the boat on this. I should have been doing this a long time ago. So if you were to say, go home tonight and think, I'm going to make this shower, this bath time a little bit more effective, it's okay. We don't have to go in there and make proclamations from now on. But I had an idea and I was wondering if this body wash and this special ride can be just for you. And I want to show you the 8 places we want to make sure we hit. You know what I mean? And just kind of walk them through. And I was wondering if we could do that. And then afterward, after your shower, let's have some popcorn and watch a movie or something like that. So it doesn't have to be a huge error or miss on your part. It just can be something that we gently try to implement, and we give them as many steps and equipment as we can.
Yes, and I think the shift in understanding, again, the individualizing of this for our children is I'll have some children come in they get in the shower, maybe the transition to the shower is hard, but they'll get in the shower and, you know, 1, 2, 3, 4, 5, 6, 7, 8, and they're out in 8 seconds, right? And then the other end of the spectrum where, oh, we got them in the shower, we're good to go, and they're in there for 2 hours, right? And so being able to break that down, whether that's, again, relying on some of these behavioral strategies and tricks that are good for your kids, as far as maybe reinforcement or, use of even a visual timer of some sort, or a timer on the phone, or use of a laminated task analysis of what to wash it. So it doesn't feel, and there's some stress sometimes related to that too, because there's the child that says, I got in, and so I showered. And then the other one that's overwhelmed, because if you really break it down task by task, there's 1,000 things to do in the shower. I'm going to adjust the water, and then I'm going to get the washcloth. That's for me. And then and if you really work in a rigid type of way, you're going to find 1,000 steps in the shower. So simplifying that, I think, can be helpful, but also going through the right and wrong, as Dr. Buehner mentioned, can be helpful.
To follow that up, Dr. Davis, in your clinical work, have you come across just anything that might be helpful to parents whose child might seem rigid or anxious about some of these changes?
Sure. Yes, and I think if we understand kind of the rigidities and the roots of some of that with the anxieties related to that, it is helping it to break down some of these things for our kids. Now, some of this could be things like shaping the behavior. So, if it's shaping the use of deodorant, we've used that a couple of times. It's like, how do I break this down into smaller steps to help, maybe if it's a sensory aspect, to desensitize some of these things. If it's a learning of predictability, I'm anxious, I don't know what's coming, I feel out of control, what's wrong with my body, there's all these other things. And then some of the education and knowledge can be very helpful to understand why we sweat, and why the use of deodorant can be helpful. So sometimes it's breaking down some of those things and giving a little bit more understanding and control back to the child. Rehearsals and role plays can be very helpful for this as well. And then just like building it into the routine again, as part of, and if it's particularly hard, then you do lean back on some of these behavioral principles where, first we do this, and then we're get to go do this. And so the more you do it, the more it can be, and it might be a long road depending on when you start, but the consistency is very important, because these are important skills for our kids. And I will say that sometimes parents pull back. It seems like a little too quick, where some kids, especially those with both autism and ADHD, need those continued supports for a long time. And then the feelings of failure related to it can cause anxiety. So keeping those up can be very helpful to help reduce some of that.
It sounds like just revisiting and checking comprehension as those changes unfold throughout months and years is really important.
Absolutely.
All right, thank you. Mood swings, emotional volatility, and shifts in regulation are part of puberty, even in neurotypical adolescents. For kids with autism, that can be even more destabilizing. So, Dr. Davis, how do you recommend parents talk about mood changes, emotional resilience, and self-regulation at this stage? And should we be trying to explain their emotional changes or simply rolling with them?
So there's multiple factors involved, right? So it's kind of this psychosocial kind of arena that we're in. So the family dynamics can have an impact on it. Obviously, I talked about already these changes in a little bit of changes in brain functioning and different. And it's not higher necessarily levels of cortisol, but it's more variable. And so there's absolutely some of these emotional volatility can come from a lot of things for individuals with and without autism. I think part of that is trying to give, and some of our parents might have already been doing this along the way, but it is a recognition of some of these emotions. So it's whether that's through the use of a feelings thermometer, if you've done the zones of regulation, or even if it's a kind of helpful, unhelpful, good, bad behavior, depending on the level of complexity that you want to get to it. It is important to understand that that recognition for some of these kids is hard, but we really want to try to of these feelings is hard, but we really want to try to. And so whether it's the use of scales or use of like interoceptive kind of practice to like teach, well, this is what it feels like. My hands sweat, my muscles tense up, my heart's beating fast, and trying to pick up some of those, and not to get, this is a completely different topic, but even the use of some kind of like wearable technologies now that kind of pick up on changes in like, we try to do a lot of what's called biofeedback with our kids and trying to figure out, okay, as much as we've tried to teach some of these behaviors or these feelings inside, it's still really hard. And so trying to show them like, hey, here's your breath rate and your heart rate variability. And when they're all erratic, that's when we feel more stress. And what that actually does is it empowers the child a little bit to say, I can change some of these feelings. I'm not gonna just blame it on puberty, maybe, or say that, hey, these things are stressful for me, but I can have an impact on them. Can be really helpful. Sometimes that can be, teaching, obviously, like what I just said, like deep breathing techniques, but there's got to be a recognition first, right? To be able to do it. Sometimes that's simply associations. Sometimes that's, hey, I can tell you're mad. What do you do when you're mad? And you have a list. You might have a concrete list of these are my child's 5 good coping strategies. And so even if you still have to be co-regulating with your child, that you can lead to a habit of some of these like coping strategies for sensory breaks or for breathing techniques. And sometimes it is also kind of a scaffolding type thing. So adjusting the expectations, where is my child at? And any progress towards the goal, I think is, even if it's a small shift, that's what it doesn't have to go 0 to 100. Small shifts between what we want to see. And then understanding also that these fluctuations in moods are normal, and it's less the autism than just adolescence. So I think that can feel good. Like, oh, there's maybe not much I can do about this at this moment because they're just going through a lot inside and out.
Awesome. Thank you so much. And Dr. Buehner, I have a follow-up question for you, but quickly, I just want to acknowledge something someone shared in the chat, which is that in their experience as a parent talking about sexuality with their kids, it helped them as a parent to then reevaluate kind of those conversations they had with their parents and the kind of language that they want to use, etc. So thank you so much for sharing that. And also, they just noted that their teens used to stay in the shower and still not use soap for hours. So if
The struggle is real. The struggle is real, Hannah. So
yeah, if that's anyone's experience, you are not alone.
It's self-care to an extent. So
yeah, yes. So, and I want to kind of piggyback on what Dr. Davis was saying. I think that kind of, again, I'm a broken record today, I know, but kind of continuing to do what you know how to do. So we know as parents of autistic children, we can't swing at every pitch. Sometimes we have to take a step back and take a look at the mood that they're in or what they're bringing to us and try to understand exactly what might be bothering them. We have an understanding of oftentimes of our child's sensory needs and sensitivities in a way that some other parents might not have to have. And so it's kind of a lot of awareness. We know it. It can be exhausting. It's a lot to kind of have to take into account at all times. But during puberty, this idea of I'm not going to swing at every pitch. I'm not going to engage in every argument. If they're bringing a bad mood home, just like you've recognized for years when they come home from school, they're exhausted. They've been on all day and now they need a chance to just release and have the grace and space to do that. I'm going to try to create an environment where they are able to kind of have their feelings. And if I see that something big is going to go on, I'm going to try to read them and not villainize them and recognize that they don't know what's going on with their bodies either. You know what I mean? They don't know what's going on with their moods either. You know what I mean? And try to have this try, it's hard, but try to have an attitude of understanding and try to meet their needs, meet them right where they're at. Sometimes that's a snack, sometimes that's space, sometimes that's making sure that the room smells nice and feels nice and they have what they need to kind of decompress a little bit so that when their frontal lobe is back online a little bit more and they're ready to have a conversation in a little bit or share perhaps or not, when they're feeling safer, that we'll be in a better space. And so again, I can be that soft place to land.
Speaking to that emotional regulation, how can parents help their child practice that regulation and self-monitoring?
It's a great question. We've said it already today, so we want to start early. We're modeling regulation ourselves. We're trying not to be yellers if we can help it, because that really doesn't work for anybody, neurotypical or otherwise. And I think the understanding of Dr. Davis mentioned a moment ago, rating scales or, feelings charts, things like that, that give us some kind of language early on in life about what sort of mood we're in today. Being able to identify your feelings, like understand something just happened, it made me feel this emotion, here's what I'm going to do to feel better. That's a terribly difficult sequence for a lot of us to learn. Even adults I know who aren't on the spectrum still struggle with understanding that sequence. So the ability to Dr. Davis mentioned it a moment ago, but say you seem sad or you seem like you have a lot on your mind, recognizing again that sometimes they're not ready to talk. Sometimes they might be agitated, worked up, edgy, and we need to give them the space and grace to kind of decompress a little bit. And maybe we come back to a conversation or a discussion in a few minutes or in a few hours when they're in a better place. So I'm trying to model emotional regulation. I'm trying to label feelings early on before when they're younger, because it's maybe less threatening. You're not telling them how they feel when they're younger. That's a conversation that we can start having early on. But again, validating, you seem like you have a lot on your mind, or you seem like you have a lot on your plate. So here's a snack, here's a hug, here's a squeeze, here's some space. And we'll talk in a little while if you're up to it, okay? And giving them kind of what they need, meeting them right where they're at, and then letting them come to you when they're ready.
Thank you so much.
To add to
go
that
ahead.
when we're teaching these skills, I think it's tempting, especially when it comes to self-regulation, emotional self-regulation, that's when I'm trying to prompt the coping to get something out of that child, right? I want to see that, hey, now you need to take deep breaths. You need to, go take a break. You're prompting in those moments, which isn't bad all on its own, but if it's only then, it's going to be less effective. The teaching of these skills, should be when the child's in a place to learn, right? So a mental place to learn. And so don't restrict it to only those times where we're trying to help and co-regulate and prompt, but actually teach the language, actually teach the coping strategy when the child is receptive to that learning and is in a calm and otherwise happy place.
Yeah, or like if you're having a rough day yourself, to say I was feeling kind of sad earlier because X, Y, or Z happened and I realized I was sad. So then I decided to A, B, or C to try to feel better. So we're modeling emotional regulation. We're labeling our own feelings. We're not just saying I need everybody to be in a good mood or pull it together or get over it. It's not that big of a deal. We're acknowledging sometimes something happens and it makes us feel a certain way. And here's what we do to feel better. Acknowledge, identify, address.
Wonderful. Thank you both. I'd like to shift the conversation a little bit to talk more about these social relationships that you both have alluded to that happen in adolescence. So, Dr. Davis, at this time, social relationships, friendships, romantic notions enter more strongly. What do you think is important for parents to keep in mind when supporting their child's social relationships at this stage in terms of teaching, safeguarding, and guiding?
Oh yeah, so there's kind of so much. There's and I know we're running a little bit low on time, but highlights would be things like from a knowledge standpoint, helping a child identify these healthy and unhealthy relationships, right? And so what are the red flags that, for example, just from clinical work, I met someone online and they like everything I like. It's crazy, like how much we are alike, right? That's probably a little bit of a red flag, meaning like not all of us have exactly the same things in common. There's also still the idea at this age, we're turning into adolescence and adulthood, some more self-awareness of if we're regularly being treated poorly by somebody, we have our own boundaries, and we deserve relationships where we're valued, right? It's like, and so a lot of the times in this age, especially, maybe there's potentially been repeated, unfortunately, negative peer interactions, and so with puberty, with changes in hormones, with or experiences with peers from time to time, there's more withdrawal in our kids, and so it is trying to find those meaning for our children. Those the relationships are meaningful and reinforcing, and where's my group of kids that I can do that with, right? Maybe that's in the school, maybe that's not, right? But being able to provide some of those, and unfortunately that often falls on the parents, as you all well know, where it's how can I help foster some of these relationships with kids that really like the things my kid likes, or is respectful of the way my kid behaves in a way. And so those relationships become complex, but definitely making the child aware of the red flags can be helpful in giving them those explicit understandings of how you should be treated as a person. Right.
I'm so glad you brought up the internet too, because I think having conversations with kids about relationships online, chat groups, the comment sections, things like that, like having conversations about appropriate behavior in those formats and those places is really powerful. And again, if kids are gaming or even on YouTube Kids or any of these kinds of things at a young age, trying to help them understand things like these are topics for a different day, perhaps, but media literacy. Do you think that's AI? Do you think that's real? You know what I mean? Having some conversations about how the video that they just watched made them feel, or if something scared them. And again, I think in terms of social relationships, we know, there's this myth that autistic people don't have empathy, but oftentimes what they struggle with is sort of cognitive empathy. I struggle to understand what you're thinking, what your thought process is, but they have an overabundance of feelings empathy, being able to understand, if I'm in a sad mood or something bothers me, or if I'm crying in a movie, my child is down, all over me trying to figure out what's wrong and how he's going to fix it. So I think that understanding that they have very, very big feelings, oftentimes everybody's different, certainly, but some of the conversations that we want to have in terms of social relationships, and I hope I'm not jumping the gun here, but thinking in terms of we can talk about the internet, we can talk about the things they see online. Another way to kind of broker these conversations that doesn't feel so, out of left field, perhaps for us as caregivers, is what do they see in movies? What do they see on TV shows? Like if I had a nickel for every time I've talked about the Goonies and the relationships in the Goonies, and the older brother dates the girl, and then the younger brother has a crush on the girl, and everybody likes everybody, or you know what I mean, or how friends get along, or how he probably felt when that kid said that. So it doesn't have to feel so clinical or boring or weird. It can be like, that was interesting. What did you think about that? Or what do you think she thought about that? Or, how they kiss in the movie Frozen, how they, kind of show consent before they kiss in the movie Frozen. There are ample opportunities to say, what did you just think about that? Or what do you think she felt about that? Or when a conversation goes poorly at school, when you recognize they come home in some kind of mood and you can tell that something went down, let's do a little bit of a postmortem on that and figure out what might have gone down. So walk me through kind of what happened and maybe some different hypotheses about what might have been going on. And again, what do we know already from today? We're not shaming. This is understandable. I'm glad you brought this to me. Use that word glad as much as you can. I'm really glad you told me, right? Because we want this to be a conversation that we reinvite and revisit if needed. So the ability to say, let's look for opportunities to teach that don't feel awkward. We can use books, we can use media, we can use YouTube shorts, we can use whatever's out there, but we can take opportunities to say, what do you think of that? Or what do you think that she thought of that? And then help them kind of understand it perhaps in a different way without shame, and something for them to think about.
Thank you so much for sharing that. It sounds like a great way that families might be able to pace some of these conversations so that kids don't feel overwhelmed, but also don't fall behind, and kind of creating that ask anything relationship where they can point something out and ask you a question and they're comfortable. And actually, someone had mentioned in the chat that when their child was in middle school, the teacher in their classroom was kind of blown away that they could have these open conversations with their child and talk about these topics, because if parents aren't able to communicate openly about these topics with their child, then who will? So I'm also going to jump ahead a little bit just because I know we're short on time. But just in terms of having these conversations, navigating puberty, Dr. Davis, what supports should parents consider, like support groups, peer mentors, a therapist to sustain this work? And when is it time to call in a specialist?
Sure. So the opportunities that I often see are these, in part these social networks, if you can, in person, not online, the social networks that provide opportunities for your kids to have moments of success and moments of even resilience at time, to be able to, again, I'm so glad that, like, despite this really bad situation at school, like, we're able to talk about it and kind of like be prepared for next time, like that. So you're preparing your child not to ever, not in this time to handle these things on their own, but I'm glad you came to me and you can do something about it next time that's a little different, maybe, right? And so so you provide those opportunities, and sometimes that's through social groups at school, sometimes that's through social groups at a clinic. I think those can be extremely helpful at this age, just to help build teamwork skills, to build relationship skills, to build a positive social experience. Right? That's what we really want to build for so many of our kids. It's just a positive social experience, and so sometimes that requires a little structure now. So a social group might be good, and then sometimes it's simply things like this, and you all came to this, and it's sometimes it's consultation. It's two or three, like, ooh, this topic is tough for me, I need specifics for my kid, and so, like, consultation can be important. And then the ongoing, or short term, or maybe ongoing therapies would be those times that you truly feel like the behaviors, the emotional regulation just is, despite the consultations, despite this, it's been hard, and my child is really needs maybe somebody else to talk to them about it than me. That's true for my children as well. So that's what I would suggest.
I think too, there are organizations in our community, Families for Effective Autism Treatment, for example, does lots of events for children of all ages, really trying to bring families together. Sometimes what you're looking for is an opportunity for your child to go just be who they are without fear of repercussions or seeming weird or different. And so sometimes finding an organization where families understand who you are and kind of what you're doing and what you're going through can be really powerful. So I really want to encourage everybody to check out FEAT. And like Dr. Davis said, try to come at it from a few different angles. So, your child has strengths. I've had the conversation with my kiddo before where you may be struggling a little bit to learn multiplication, but if they ever need somebody who knows about dinosaurs, you are the guy they're going to go to. You know what I mean? So we want to play to their strengths. We want to build them up. We want to really fluff up, grow, nurture, nourish, appreciate, acknowledge, and celebrate their differences and their strengths. So I know that it is not always easy, and sometimes we we operate trying to worry about the deficits, but sometimes thinking in terms of how do I get them in front of people who will appreciate this particular part of them because they are going to rock it.
Awesome. Well, I want to make sure we leave a couple minutes for questions. So I have one more question for each of you. Dr. Buehner, as we close, can you briefly restate the 5 things that you hope each parent here today will take home tonight and start doing? And then once Dr. Buehner is done, Dr. Davis, if you can add one final clinician tip for parents who are embarking on this journey with their child.
Okay, so as awkward as it sounds, I want to encourage everybody to use concrete, structured tools if needed. So grab a book from the library, grab a book. There's a million of them out there. We talk about the Tom series for boys, but there are equivalents for girls, and having these conversations for kids who are questioning. We have all kinds of resources. And if you have any questions, please reach out to Hannah after the presentation. She'll put her contact information there in the chat so that you can ask for further information from today, contact information for myself or Dr. Davis, or resources, because we really want to get those to you. We want to talk about private behaviors. And again, we can talk about that in terms of what covers your bathing suit or what rooms that we use, or just kind of taking what you've already told them and moving that into kind of this new realm of privacy. And so private versus public behaviors is going to be an important conversation. And remember, when you have those conversations, the taboo is probably internalized within you. What they need from you is just the information. So we want to talk about mood regulation and kind of some of the changes that they might expect and adopt it. You do it your own way, each of us has to, but that attitude of knowing a lot of things that are going to be mysterious to them are going to be happening. So to try to be a soft place for them to land and have the same kind of understanding and perspective that you've had all along. There's a reason that you're here today. Finally, in terms of social relationships, we want to talk through conversations, talk through consent, use examples from media, talk about their reactions to what they see online, talk about chat groups and things like that. So that's going to be something that KPF is presenting more about in terms of a child's web presence and their mental health. And remember to revisit these conversations as you go on. It's not one and done. It's something that we kind of build on early. And there you go.
Thank you so much. Dr. Davis, do you have a clinician tip for us?
So I'll just add that, we didn't even get to talk about everything we wanted to in this hour, but it's, and we know that because there's so many things to talk about, but do simplify it, take one thing at a time. What's going to make the most change in this moment, for your family, for this child? And like I said, any step towards kind of this goal, the desired behaviors we want to know, you're on the right track, right? So it might feel that I'm sure it feels like, well, there's more I could do, but really, truly, anything that's moving towards this hard transition for our kids is so important. And again, to normalize these things and make it a frequent conversation. Make it one that is your child understands that these are hard things, and that they can do something about it. They can work towards this too. So it's hard, but also I can.
Well, thank you both so much for this wonderful conversation. We'll open it up to questions. So while I share just a little bit more info, if you have a question, you want to drop it in the chat, please feel free to do so. And we've got some links in the chat for some great resources, including Kentucky Psychological Foundation, Mental Health America of Kentucky, Norton Children's Autism Center, and the Kentucky Autism Training Center through U of L. I've also put my email in the chat for any follow-up questions that you might have. And I'd like to thank the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities for supporting this through a SAMHSA grant that we received through them. I don't see any questions right now. I see a thank you for the information. And we're just so grateful to you all for attending and joining us today. And it doesn't look like we have any questions right now, but again, our email is in the chat, so please feel free to reach out if you have any questions. Thank you again, Dr. Davis and Dr. Buehner, and have a great day, everyone.
Thank you, Dr. Davis.
Thank you.